So everybody, this is my dentist, Dr. Shawn Sadri from New York, and I just kind of wanted to have a conversation with you about what dentistry is going to look like in this era. And I have to tell you, I said it before you got on, but I am extremely fascinated and intrigued by this conversation. So I'm looking forward to it. But before we jump into that, how are you doing? How's everything going?
Everything's good. Everything's well. We're keeping busy. We're preparing to pretty much open now. We're, past the 2.5 month mark, so we're getting there.
Okay.
Doing. How's everything doing?
So you've been in New York quarantining, right?
I've been in New York quarantining, yeah. So I've been actually very productive during the time, so it's actually been pretty nice.
Nice. And how has the quarantining been, personally speaking, how's it going?
Yeah, so when it first hit, I live on the Upper East Side, so I went home to my parents' house in Riverdale, stayed there, a little more room, and for the especially for the first month, I was doing a lot of continuing education courses, really reading up the new dental technology, which really, sometimes you don't have much time to do when you're really working. So it was nice. I actually, purchased 2 intraoral scanners for the office, a new laser, so I really got up to date on everything, which was really nice. I would never have time for that. So that was pretty much my quarantining. And then the past, month or so really preparing to open up the office, we'll talk about, the new precautions, all the new aspects of it.
Quick take on the city. How's it been?
I mean, it's very slow, very dead, honestly. Yeah. I come to my office, no one's there, and still up to date. I've noticed like other places kind of opening up-ish, but the city is no one's there, up beside no one there. It's a little scary. And now you feel a little better, honestly, at being out here, as opposed to the city.
Yeah. So. And when I came to my appointment, I was super impressed because you're obviously like on the front lines of all the technology and forward thinking. So I'm sure we're going to hear all about that. But so in terms of the business and your practice, you said you're open or?
So we're preparing to open sometime next week, especially for emergencies. I've not even seen one patient in over 2.5 months. I've had patients want to come in, but I really want to make sure I was prepared with the PPE, with the new devices to really open up, make everyone feel safe, make my staff feel safe. I really didn't want to really press and to open too soon or anything.
Yep. And what are some of those, like, I guess, take us back to when the pandemic kind of hit. What have you been thinking about? Like, what are some of those changes, and from specifically with dentistry, like what are the safety precautions?
Yeah, I mean, listen, it really just kind of hit really quick, honestly. It was crazy. Everything was fine. People are getting worried about Corona. Have you felt it? I'm like, no. And then you kind of felt it, like week by week, kind of just really, even day by day, just like, and all of a sudden everything just changed. And everything got shut down. And again, as you know, dentistry is it's aerosol just for your patient's mouth. So this changes everything. So when this happened, I was like, oh my God, this is definitely going to change everything. So I really spent even the 2 months, even really the past month, like what do I have to do to make, my patients feel safe, my staff feel safe, for me to be safe, for everyone to be safe. Because, everyone's worrying these days and I want them to feel comfortable and I want everyone to be safe. So that was the main thing. And then we started a whole new protocol, and that's what we're going to start next week, and everything's changed pretty much.
So what can you share? Like, how's an appointment going to look different?
I'll go through everything. So, obviously, I usually have a front desk. We're eliminating the front desk. My office manager is on remote. So pretty much you're going to text my office manager, say, hey, I'm here. As you remember, we're on the 8th floor. So you come out of the elevator, 8th floor, there's a glass door. You text my office manager, we're here. Either I or my assistant, that's the only people you're going to have contact with the whole time in my office. So either I or even my assistant will come out, we'll take your temperature right outside. We'll escort you in to the office. We'll bring you right into the operatory room. Okay. If the main room is still taken, then we'll have you sit in the second operatory room. But we really just want to have one patient at a time. That's it. So we'll bring the patient's operatory room. It's just me and my assistant. What the really changed is the PPE. Before it obviously was very casual. Obviously we always wore a mask and protected. But now it's it's gown, like a hairnet. The N95 mask, a full face shield, shoe cover. It's really gone to extreme. Dentistry offices were always very clean. We're always disinfecting, but now it's 1,000 times more. That's pretty much the difference. One main thing, the device that is definitely a game changer is it's an extra oral suction device. It pretty much it is a device that really sits almost at your mouth. Besides my system suctioning, that machine is there sucking all the air. So all the aerosols and all the respiratory droplets, it sucks all the way out. If you actually go to my Instagram story, you'll see it. You'll see it in action. So that is really key because we don't want the aerosols in the air. Then the aerosols go into the machine. There's a UV light that kills it. So that is really one of the main things. And then we're pretty much, checking you out. Again, we can check you on a tablet. If you don't want to touch a tablet, which is disinfected, we can have you FaceTime with my office manager on your own phone. So again, limited contact. That's it.
I mean, are you Upper East Side all the way?
Yeah, I mean, listen, I can go move Upper and West Side. I don't mind. I'm in Midtown, Uptown, honestly. My whole life is there. I'm not that young anymore. I don't go out really. So I mean, I love the Midtown, being close to office, Upper East Side. My parents in Riverdale. It's great.
Oh, so your family's all in Riverdale?
My family's all in Riverdale. Yeah.
Oh, nice. Okay, cool. Are you going to open more offices, you think, or?
It's very hard to, especially now too, to kind of, put yourself in each office. It would have to be like, you can open an office, but other people working, and then you kind of limit yourself. You miss things, in my opinion, if you're not.
Yeah. Got it. What else other than the gym in your apartment, what other kind of stuff are you missing about New York City?
I'm just missing the livelihood, going to a restaurant, seeing people, seeing my friends, all these things that you really took for granted. And it is the city. It's just crazy how everything's gone. I mean, just putting a mask on, putting gloves on to go outside. It's crazy. But it really shows you can't take anything for granted. But it'll be back soon. It'll be back.
I agree. So not taking anything for granted, is that like the biggest takeaway from this 2.5 months, I guess, however long this has been?
Yeah, I mean, you just have to be happy for simple things. I mean, it's something like out of a movie. It's like you've watched a movie like this before. You're like, oh, this will never happen, blah, blah, blah. And it's crazy. It's really crazy that this happened. I still can't believe it. But hopefully everyone's used that 2.5 months to be productive, learn something new, make a positive out of it. There's really nothing you do, unfortunately.
I hear you.
Be positive.
So what's day one after when the ban's lifted, except for going to work and meeting your patients? What are you going to do?
I would love to go to a nice restaurant and sit outside. Hopefully it'll be summer, weather will be nice, and we'll just go sit outside and relax and just people watch, because that's the whole thing about New York.
Cool.